Hi, hello, namaskar everyone. Welcome to Dhwani, which means sound in Hindi. We bring to you resonating sounds created by the actions of women innovators, leaders, experts, and entrepreneurs who are making a difference in their and others' lives. We share their stories to inspire and empower other women. Dhwani is an initiative of Innoberry, which is offering a platform for the women to voice their thoughts, struggles, challenges, achievements, highs and lows, and the journey that they have undertaken. I am Pooja Bhatia, a tech transfer, patent licensing, and intellectual property professional, and now your host for this show. Let's inspire and get inspired. Dr. Varsha Singh is currently leading the team and company Medzak Healthcare Pvt Ltd as the Chief Executive Officer. She is a Ph.D. from Panjab University, Chandigarh, and has 1 year of experience working in medical diagnostics, especially non contact and minimally invasive devices. She is also working as an assistant professor in Chitkara University. So you can see she's wearing multiple hats. She was also awarded as the BIRAC-TIE Women Entrepreneur Research Award in the year 2020. Welcome, Dr. Singh, to Dhwani. This is our first episode, a special series covering women entrepreneurs. I have termed it as trailblazers, and Dr. Varsha Singh is one of them. She's my first guest on this series. Welcome, Dr. Varsha Singh. Thank you for joining us in today.
Thank you so much, Pooja, and it's an honor to be here and the way you are carrying it out and giving us this opportunity. Thank you so much.
The pleasure is absolutely ours because we are going to learn from your experience. We would, like to know more about the product that you're developing. What is the problem that you're trying to resolve? And what is your market that you're trying to target?
So Medzak Healthcare, when it was incorporated, it was covering ophthalmic devices. I was teaching a few students who were going to their trip to the Himalayas with just a torch and a pen. So this is where the idea came that ophthalmic care is something that is needed as it is a secondary rising pandemic. And currently, the ophthalmic devices are very expensive and they have only 2 to 3 applications. And the devices are very bulky and costly. Whenever these camps are organized in the rural areas or even in the urban areas where the hospitals do not have sufficient trained technicians for operations, this requires portable, cost-effective devices to be created. And this is where we found ourselves to give what the unmet need of the society is. Medzak has created a low-cost solution to fulfill the needs of the ocular market and where diagnostics are difficult to make and import, particularly in the third world countries. And Medzak is the first startup firm that has developed and intends to release an innovative ophthalmic handheld device, which has built a first of its lens system. And it's a point-of-care diagnostic device for preliminary diagnosis of eye diseases, abnormalities, and features.
That is really interesting, and would like to congratulate you, Dr. Singh, for coming out with such a device and simplifying it for many people at the end of the day. So, how do you perceive who would be the end users for you? Is it just limited to the doctors, or it could be used by anyone?
So, as I mentioned, it's not only limited to the doctors. Yes, doctors are the end users. And as I mentioned, that there are around 50 to 250 camps organized in rural areas or the nearby camps. The areas where eye care checkups are very, very common. Medzak is actually seeing this product as its primary market in the Asia Pacific region and in the Latin, Middle East, African countries as well. Mm-hmm. And this product will not only be used by ophthalmologists or optometrists, but even the primary healthcare practitioners, the ophthalmic nurses, and even the technicians can use this product in rural areas and with minimal training. So the potential market of this ophthalmic diagnostics, where the non-invasive and non-contact preliminary diagnosis is carried out, it's very much promising. And the market placement for this product will definitely not be identical to the existing products because it is actually out competing. And it will have a more extensive acceptance with ophthalmologists and optometrists in the developing nations and the third world countries, because still when we see ophthalmic products, they have been covered under eyelid surgeries, biometry, visual fields, refraction, and basic ophthalmic preparations, but ophthalmic devices are yet to find their places. And in the next 7 years, Medzak foresees a very massive market for hardware diagnostics, especially when AI is coming as a precise diagnostic platform, and this will give medical training a much more helping hand, and more of the students can be trained, because one of our implementation partners, they have not bought any equipment for the past 8 to 9 years, and no tender has been crossed. So this is a very cost-effective device where it can be used for training the academicians also. And we are seeing a global ophthalmic device market, which is estimated to reach and expand to approximately $50 billion by 2027. And Asia Pacific is currently holding 25% of the market, and the LMEA countries are holding around 9.5% of the ophthalmic market. And with this primary market valued at 3.2 billion in the coming year, and Indian market alone, it is valued at 1.3 billion in 2027. So since the Indian market is expected to grow at 6.8 to 8% CAGR in the forecasted time frame that we have studied, so we plan to capture 5% of the market in the coming 4 to 5 years.
That is wonderful. Dr. Singh, I would like to share an incident with you. So, on my last daughter's doctor visit, her doctor was checking her eyes and they were using a mobile to scan and see, but
Yes.
but she kept on moving and they couldn't capture it properly. And then
Absolutely.
she was very cranky. So I couldn't even ask them which app it was. But I do remember the nurse, particularly commenting that it really helped them. So whenever I go and meet doctors, being a science student, I'm always inquisitive. What are the technologies they're using? What are the medical devices they are using? And this kind of, captured my attention, and I wanted to talk about it more with them to learn what is it. But unfortunately, because of my daughter, I couldn't do that. So I believe that, your product would definitely be useful not just in third world countries, but also in countries like US. Yeah. So you have a bigger market. And as you say that,
Absolutely.
5% of the Indian market is what you aim to capture in the next 4 to 5 years. So,
Yes.
so all the best to you for it.
Thank
And I'm
you.
sure you
Thank
would
you.
do it.
Sure.
Dr. Singh, you started in the year 2018. I'm sure year of pandemic would have, overlapped. So did it have any effect on the entire process of developing the product or, even starting up?
Absolutely, it did. We incorporated this startup in November 2018, and by June, we got our first grant in 2019. So within a span of 5 years, we were doing great, getting our team together. And, it's a medical devices, very hardcore R&D is required to put this medical device into the process of getting the basic structure ongoing. And then the pandemic hit. When we were planning to give this R&D a structured approach and getting the hardware developed, most of the components that were to be procured, they were from outside India, and there were also some backlogged equipments also that we required to make the whole simulation analysis for the medical devices into running. So the technical development of the product was a huge setback because the import and exports were affected, and it did not end there like just for 1 year, because partially the lockdown was opened, but it went on for another year because there was a second lockdown as well. So but our team was my whole team was really supportive, and we stuck around together, and we were working together, we were solving the problems, and we had a plan A initially, but since due to lockdown the plan A was not working, and then we switched over to plan B. When the plan B was not working, then we switched over to plan C. So it's always good to have a lot of plans in the back end to work and continue to work. So yes, pandemic also hit us. We would not say we were suffering, but our team was so cordially adjusted together that we were able to work out things. It did take us 1.5 years back, but I think we're still at it. We're still ongoing.
So you have given a very important tip that even though there may be challenges, you may have to change your plans that you have made. You should still stick on to the path and not leave in between or on the startup that you're working on. So, but I hope now the product development is moving on track because things are slowly getting back to normal.
Yes. So our product right now, it's at TLL6 stage, and it is only because of my team that has reached at this level, since they have been a supportive in the whole process. And the technology readiness level that presently the device is at, it is at TRL 6.
What are your next plans for the company? As in, how do you plan to take it ahead?
So we are planning to, take and make the minimal viable product, because we're already at TRL 6 and there's some advanced level of testing that are going on. And we plan to incorporate the advanced optics so that we can compete with our competitors, and so that we can also capitalize the market development, because, the advanced techniques is what is required. And definitely the penetration prospects in the field of non-invasive preliminary AI-based ocular health detection system is what, our company plans to incorporate. And this will be a very solid foundation, as well as for the market level product to be introduced. And since there's a demand of ocular therapy, it is increasing every year, especially in the Southeast Asian and African countries, because as I said, it's a secondary epidemic and there's a 17% rise in the cases. So definitely we plan to take an advantage of the opportunities for the market development and penetration in the field of portable medical diagnostics, because the 10 years for a portable medical diagnostic market is very promising.
Yeah, I agree. But like I had introduced you, Dr. Varsha, you are an entrepreneur, you are a faculty working with a university. How do you manage your time, juggling both the positions together?
So it's I wouldn't say it has been a really difficult journey. It was difficult initially when you start with the company, you try to raise funds, because as a faculty I was also juggling between my research as well. But then pre-planning is what is very much required during those difficult times. And since I had to completely devote my time to academic research and in the official hours as well, in the unofficial hours I used to carry out the whole process, and I still do. Late nights are devoted to my company, and all the related meetings happen after 5 o'clock. And this is where I devote my time, especially in the official hours I do my research, and in the after 5 it's me and my company and my teammates, and we devote at least 4 to 5 hours in getting the product going.
So it's like working for 24 hours, because I'm sure even though you have kind of divided it between official and non-official hours, but there would be numerous things that are running in your mind, even some ticks that are left to be ticked off yet. So hats off to you managing both the places. Dr. Varsha, would you agree or disagree that entrepreneurship teaches us more than any other profession?
Yes, I absolutely agree to that. When I started my journey, as an academician and as a researcher, it was only in one direction. We did not have to think about other directions, and it was just work and then finished off. And, your first subject tries to teach you the basics, and entrepreneurship teaches you how to implement that basic knowledge. And as researchers, we call it bench to bedside, bringing that research to at least in the healthcare sector, bringing that to the clinical implementation. So in case of healthcare products and services, we require that R&D to go into the market and create some impact. So entrepreneurship brings out, other skills such as the analytical skills, they enhance your fast decision-making processes, which otherwise we do not use so much. And not only this entrepreneurship, we focus on the product technicality, which obviously I have to and my team members also have to, but we try to explore different fields. We focus on the team, we focus on their working, we focus on time management, finances, and business plan development, customer interaction. And we have to do that regularly. We have to keep ourselves updated with the technology as well. A lot of different agreements, different domains, they all must be operated at the same time. So it's like we have to move in all directions. And this is what entrepreneurship teaches you. You're already multitasking, but you have to be maybe more multitasker, especially when it comes to entrepreneurship.
Yeah, one of my earlier guests had Dr. Singh mentioned that you have to wear different hats when you become an entrepreneur. And you are echoing the same thought that, it is not just about the technology or the product or the service that you are working on. You also have to think about the all other roles. As a startup, Dr. Singh, are you working or, looking for any collaborations? Because collaborations are very essential at an early stage. So are you looking for partners and collaborators?
Right now, we do have partners and collaborators, especially for the technical development of the product, where we have various academicians, we have various clinicians on board. and we have various mentors on board as well and advisors. But now we need to jump on to looking at how we can collaborate with industries and making this industry ready product. Since right now it's a lab ready product and also it has been implemented in the clinical settings, but the industry partners are very important at this stage for us.
Yeah, I think even to take it further, you would be needing some form of fundings and other networks to,
Yes,
move
yes,
forward, and also have
absolutely.
some agreements in place because collaborations would need some legal structure. Yeah.
And
So, but
we are looking forward few partners not only from the industry level, but looking for advisors who can help us capture that market what we tend to capture in the next 4 to 5 years.
sure, sure. I hope through this interview, some of the people do contact you and, you find good collaborators and advisors for your startup. But
Yes,
definitely, Dr. Singh, your startup is one of those startups to keep a track on, and I'll be
yes,
awaiting more developments from your side. And I hope, next time when we meet, you would be showing me the product that this is here and
yes,
it's
absolutely.
already been selling in the market. So
Yes,
thank you so
absolutely.
much. Thank you so
Thank
much
you.
for joining me today for this episode. It was a pleasure having you. And I thank everybody else as well for viewing the episodes till now. More is coming up. There are many more entrepreneurs who would be sharing their story and their journey. Please do keep visiting our LinkedIn page for the latest information. Thank you so much. See you soon.
Thank you, Pooja. Thank you. It was an honor. Thank you so much.